I'm Rabbi Daniel Brenner, the Vice President of Education for Moving Traditions, and I'm thrilled that you're here to talk about decoding distress and teen mental health as we mark Mental Health Month. And we are here with one of my favorite people to talk to about mental health, and that is Dr. Jess Shatkin. A few years ago, I had an opportunity to read Dr. Shatkin's book, Born to be Wild, which is a great read, and I recommend it to everyone. And I had a chance to interview Dr. Shatkin, and I realized that not only could he speak to so many issues of adolescent and teen health and parenting adolescents and teens, but also to some of the aspects of being a Jewish teenager and talking to Jewish teens specifically. And tonight, we also have an amazing teen who is going to give us a teen perspective. Joining us is Sylvie Simmons. Let me tell you a little bit about Sylvie because you got to read her bio in the PowerPoint there at the beginning of the webinar. But in addition to being a rising junior and a congregant at Temple Aliyah in Needham, Massachusetts, and also a Kol Koleinu fellow. She's part of one of Moving Traditions fellowship programs. She also is a avid squash athlete and is in the play Newsies, in the musical Newsies right now, does a lot, and has been an advocate and an activist around mental health issues. So I actually want to start this webinar tonight. We're going to be talking about decoding distress. I really want to start the webinar with some of your thoughts, Sylvie. When we first spoke, you were telling me how much now, even a couple of years later, the COVID years had, how much of an impact those years had on your generation, on your mental health, on how you think about mental health. So before we start talking about mental health and parenting, I'd just love to hear a little bit from your perspective. What did you notice about your peers, about yourself? Um, what what is the impact that you saw at that time, and how is it still impacting you?
Yeah, I think this is a very complicated question with many answers, but I do think that something that was very just impactful about it, of course, was that we were in isolation, so we're kind of alone. And for teenagers, especially, or like 12, 13, 14 year olds, that's kind of a time in your life when you're really just generally like figuring out who you are. And so to be doing that while alone is just very different than what most people go through. And other people are always just in like influencing who we are and how we think, and so to have to do that kind of alone is just a very unique experience. And additionally to that, with COVID, I think social media use really increased because of course it's been increasing just in the past decade, 2 decades, but with COVID I think it increased even more so just because um, kind of all we had to connect with people while we were in our homes was just social media and texting and calling. And so I think social media played a big role in kind of how kids grew up during COVID, because you do get a very skewed perspective of what everyone else is doing through social media, and it's just hard to really understand what's going on in the world around you. So I think it was just a very confusing time to grow up. And in regards to mental health, I think that just the isolation of course had an impact on people because like we need to be around other people in order to function, and that was kind of taken from us. And then also just similarly, just the social media really, I think, um gave people kind of a place to talk about mental health and struggles without having to like show their face, which I think made it kind of like allowed people to be more open in some ways, and also just to spread a lot of new information that like people were, like kids specifically, were being exposed to just um as they were on social media, and they might not have necessarily been exposed to the same kind of like information as they had been previously. And yeah.
I love the two major things that you just said there. And one being um, you were feeling alone, and like being alone is not like where you figure yourself out. Like it's so important to be with other people. It's so important to have other peers that you can talk to figure things out. I mean, that is a deeply Jewish idea, like being part of a kehillah, being part of a community, being part of a group of people. That is so core to, I think, why we value Jewish community. But the other thing you're saying is also just so interesting to me, that teens were learning about mental health in a way that maybe they never did before. And Sylvie, we're going to come back to you, but I kind of think that's a perfect segue into bringing Dr. Jess Shatkin into the conversation, because I really feel like this is something that I have been hearing a lot of. I just heard professor from Oxford University, Lucy Folks, and she was talking about this process by which teenagers today, they're on TikTok, and what's happening to them is they hear about something. So they hear about high functioning anxiety. So what do? They go, I'm going to see, oh, here's a video, 5 things you know about, you didn't realize that you have, and then she talks about these 3 stages: increase awareness just because they see it, then over interpretation, in which they start to think, oh my God, that must be me. And then finally, she talks about self-fulfilling prophecy with teenagers and TikTok, which basically she means by that, they think, okay, if I have anxiety, then I need to avoid social situations. Or if I have depression, then every time I'm in a down mood, I've got to just say, oh, that proves that I have depression. So there is a lot of this discourse right now around, and I think this is what's so new about this generation, discourse around the awareness of mental health being one of the challenges that teens are facing, maybe even one of the sources of distress itself. So I'd love to hear your response or your reflection to that. Is that an accurate depiction of this new reality? Is that part of what we're seeing coming off of COVID? From the perspective of someone who meets with families and tries to help teens with some very severe issues, like what are you seeing and what are you sensing?
Thanks for the questions, because there's a lot
A
in
lot
that.
of questions there.
A
Yeah,
lot in there to unpack, as people say.
for
So
sure, for sure.
I think that there is an increasing recognition that mental health is a concern for young people. I don't think that this is, you started off with the question of COVID. I don't think this is a COVID only outcome. I think actually I know that the trend towards increasing diagnoses of kids and increasing problem recognition really began around 2010. And that's when, as Sylvie mentioned, I think wisely, smartphones or the access to media increased greatly. And we've been seeing with every generation we study, increasing numbers of kids with mental illness, increasing numbers of adults who are affected. But those numbers really jumped to an unexpectedly higher number around the time of 2010 and beyond. COVID, I think, punctuated that, made it more difficult for many kids, not all kids. Some kids actually were preserved by COVID because they weren't able to hang out with as many people and get into as much difficulty as they had. So some kids did a little bit better during that time emotionally. But for the most part, yes, there was breakdown in the system during that time, and breakdown for a lot of kids, and kids got behind in lots of ways. But I think what your question or comment leans towards in your reference to the source you described is talking about this maybe at least in a sort of surface way, too much or agitating or something. I think that's what I was hearing. And I think we understand that these very soft touch sort of discussions of mental health, like, boy, you must be stressed. There's so much stress going on. Let's do a very brief intervention at school and talk about something, or share a moment of a quiet reflection and then feel better because we know we're all stressed. I think generally that probably makes things worse. I mean, there's reason to believe that that makes things worse, or that doesn't help. There are things that do help. And the things that help, of course, are all the treatments, but that's on the back end. What can we do to prevent the problems that we're seeing? And there I can give you, get your paper and pen ready, because there is an awful lot we can do to prevent a lot of the breakdown that we're seeing. But it's not just saying, okay, are you stressed out? Read this poem. You're stressed out? Let's have a brief discussion. Let's breathe for 5 minutes. there are real things that we can do based on the science that might include some of those strategies, but are
Yeah.
not exclusive to those strategies and are not the kinds of things that a lot of people are tending to do right now, which is touch it very quickly and move on. Or
Right. I mean, so what I hear from you is that like the superficial like mental health moment or the superficial ways of just trying to like I would just say put breathing exercises or slowing down exercises or into other things is not sufficient.
That's
It's
right.
not,
That's what
it's
I would
not
say.
sufficient.
And in fact, sometimes that we have reason to suspect that sometimes that may worsen things because it may stress kids out to think, oh my God, everybody around me is stressed. Oh my God, I'm stressed. Oh yes, I need to not be stressed. I need to do something about that. I
So
think
right. So they need a message that like stress is somewhat normal. Like what are the messages that you think they need to hear about this other than like, everybody's stressed out and you need to have this.
Yeah, I think that what you're saying is right. Stress is normal. And in fact, stress is good. A certain amount of stress is necessary. We've known for over 100 years, theoretically, but probably for the millennia that we've been around, that a certain amount of stress gets the job done. If you don't believe that you're not going to have food tomorrow, why go look for food? So you need to have a little bit of pressure on you. Too much is too, and it's not a little bit. It's actually a moderate amount. A little bit of stress or a moderate amount of stress is good. But too much can be overwhelming, and recognizing stress and knowing what it is and knowing what its signs are and knowing when you're getting to a place of discomfort and having all these strategies, not just in hand when you're uncomfortable, but having them in advance as part of your process. So, for example, kids today, we estimate, are running a mile 90 seconds slower than they were 30 years ago. Well, that's a concern. We have a lot less exercise in school. And now we know that exercise is not only good for your heart and lungs, but it's good for your anxiety and your depression. In fact, we have very good studies now showing that exercise is as good as medication or psychotherapy for mild and moderate levels of even diagnosable anxiety and depression. Well, that's enormous. So we take that away from our kids because we're so worried about them getting in the right school or getting the right SAT score or whatever, or the right clubs or the right this or that. But in fact, we're depriving them of something that's really essential when we do that too much. So there's a lot we can do here to help them moderate stress along the way. And then when they get there, there's a lot of strategies we can be teaching them. I'm a big advocate, for example, for schools having a neuroscience curriculum, which is not just the brain, but it's the brain and body. It's the brain and behavior. So we teach kids from a very early age and then on throughout various levels of schooling, how the brain works, how the body works, how we respond to stress, what happens to our mood, what happens in our sleep. I'm willing to bet that nobody in our audience ever got any training in sleep unless they went to medical school. And even there, they probably got very little, as most of us do. But we spend a third of our nights asleep, a third of our lives asleep, I'm sorry. So there's a lot to that. So there's many places we can.
I spend about a third of my night asleep, but that's
Yeah,
another
well,
story.
that was my mistake. And that's
So
unfortunate, but we can fix that
right.
too.
I love what you're saying. It even suggests to me that we need a new health and well-being curriculum for specifically for adolescents. I mean, as a person who trains, so many folks to deal with adolescence, what are the things other than sleep and stress and exercise? What do you put in that curriculum? What are the basic levels of awareness that you feel like an adolescent needs as they enter
Sure.
into
Sure.
stages
Yeah,
of puberty?
so I think recognition of how the brain and body are linked is very helpful. And when we teach people to sleep, or we teach them cognitive behavioral therapy for insomnia, which adults and adolescents can benefit from if they have sleep troubles, and works just as well as medicine and lasts longer than the medicine. Or when we get them exercising, teaching them about how their brain and body interact is helpful as part of that process. Nutrition is another thing, and we've spent very little time studying nutrition, but that's another one of those preventative things. So these are some very basic things, but beyond that, you ask, what else is involved? Communication skills, an enormous lacking in our school system. When you talk to parents and you say, what do you want your child to be able to do in 5 years when they graduate high school, or when they go off to college or whatever it is, or next year or 10 years from now, parents don't say, be really good at trigonometry. Nobody needs trigonometry. I'm a physician. You need like 3 weeks of trigonometry to be, I mean, if you're a
Yeah, a
physicist,
little bit might help. Yeah.
Oh yeah, a few weeks, but you don't need a year of trigonometry, but you need a year of prevention and probably many years of prevention. The things that we need to do to survive. Why do we get into difficult situations and conversations? Why do we get so upset? Why are we so disturbed when someone says something that might implicate us? Why do we personalize things? So how do we understand ourselves and our engagement with others? There's a lot we know about that. It's what I spend family therapy and couples therapy time doing, and it really works. And so there's
Right.
a lot of that we can teach young people. We have a whole program at NYU at the college where we teach people this stuff, and it makes an enormous difference in their relationships. All the healthy habits, exercise, sleep, nutrition, but also organizational skills. There's some real value to teaching people how to organize themselves. And many teachers make efforts to do that, but it's not always an evidence-based effort. And goal setting, those are things we can help people with. And then we have a bunch of tools beyond just sleep and exercise around preventing anxiety, knowing the neurobiology of anxiety and depression, understanding how we can impact that. Mindfulness is part of that, but all these cognitive behavioral therapy tools that we use to treat people with depression and anxiety can also be used preventatively. Understanding thinking errors or cognitive distortions, understanding behavioral activation, or the just do it Nike commercial, get out and do stuff. You will feel better. You will engage further. You will perform better and you'll feel better about yourself. And then managing risk. So all of these kind of things can be bundled in curricula and tied to a biological understanding. And that is what parents want. Parents don't say, be good in trigonometry or Shakespeare. They say, I want my child to be a good citizen. I want them to be a team player. I want them to collaborate well with others. I want them to have democratic principles in mind. And that's what we all want for our society and our kids.
Yeah, I think like within the Jewish community, we talk about shlemut, a personal well-being, in the sense of like, who am I? Where's my heart? Like we have like a different way of thinking about self-reflection, and also just the idea of chesed, of like caring relationships, like the idea that like you have to communicate to really understand others. I think some of those values are so core to what we want to convey to teenagers, and we want communities to like really support teenagers with. And I'm just interested to hear from you, like what do you think about all these folks who say that we are like up against something? Like I hear, for example, Jonathan Haidt has this new book about the anxious generation, talks about the rewiring of the brain that's happened because of social media. And you hear, I know that I know that there are people who are talking about like the teenagers are in such a transactional culture that it's so hard for them even to have this kind of sense of any sense of self or self-awareness. Like, do you feel like we're up against something that we haven't been up against before, or do you feel like these teens have?
I think it's the same
What are your
sort of
thoughts
thing.
on?
Well, I think it's the same sort of challenges we've had before, but I think on steroids. The social media and the access to phones and 24/7 communication is a big opportunity. I'm not thinking we should put it in the closet. I don't think we could put it in the closet and get rid of it. I think it's the way the world is, and we are adaptable. That's the greatest thing we are as humans, is adaptable. We can appreciate and adjust to new situations. But I think that the phones, particularly I say phones, but all of the online
Sure.
activity presents a challenge. And it's not new in that we've always had social challenges. We've always worried about what other people think about us. We've always compared ourselves to other people. We are built to do that. We are designed neurobiologically to do that. But this plays into that vulnerability and to an extraordinary degree. And I think that is a concern for young people. So I think we have to do some real work on this. For example, teenagers, according to Common Sense Media, are spending over 8 hours a day on screens a day, not for school. So that's entertainment. And middle school kids about 5.5 hours. And if you're an impoverished or from a marginalized community, you're spending even more time because you don't have a place to go to exercise or a club after school or a parent in the home to get you to do your homework or whatever else it is. So you end up spending even more time. And this is a real disadvantage. I think that there's no reason that I can identify that a child needs online access in school, for example. And states are starting to put some limits on that. And I think that's actually a really good thing. Because they just, if you look at if you have an iPhone, for example, and you look at the screen time, you'll see how much time you spend or your teen spends on the phone. You'll see how many notifications they get a day, how many times a day their phone buzzes. And it's probably 300 or 400 times. That's really distracting when that's in your pocket. And, it's like passing notes. We pass notes in school, but
Sure.
that was Stone Age. Now they're passing texts back and forth constantly in school, and that's very distracting. It makes it hard to focus. And I'm finding amongst the kids who I deal with in clinical practice, not across the board, but as a general trend, both in I would say middle school, high school, and in college, a lowering of resilience, a lowering of tolerance and digging in and fighting back and pushing. Not that kids are awash, but there's a real difference there. I think that there's a different approach that hasn't always favored them. I'll give you one simple example.
Yeah.
In the past, if you wanted a better grade on a test in college, you had to go to your professor at office hours and talk to them. You couldn't send off an email in this very sort of anonymous way, and you couldn't go to Rate My Professors and say they're good or bad or different. And all of that has a huge impact on people's behavior, and it's not good for people.
I mean, I've read a couple of books by Lisa Miller from Columbia University, and she talks a lot about resilience with teenagers and says that like they just are not as resilient as they once were, mainly because they're disconnected from the natural world, and disconnected from just, some of the things that you talk about in your book, like taking basic risks, and like taking risks builds strength, and taking on responsibilities in the home builds a sense of resilience. And so thinking more about from a parenting perspective, like how is my kid being challenged? How's my kid growing in those ways? I think that's a really important piece to it. I'd like to just ask you to say a little bit about the parents of teens, because when I hear, like, I've become very defensive when people say teens are like, their brains are rewired by his phones. I'm like, so are their parents. Like, that voice in my head is always like, what are you seeing with parents of teens? Are we seeing a generation of parents who are enmeshed, or maybe they are passing on some of their anxiety about their teens' mental health to their teens? What are you seeing there, and what have you learned over the last few years? I'm really interested in this part of your work.
Yeah, I'm gonna put a pin in that for 1 second, but just say that this issue, because you mentioned this from Jonathan Haidt's work, and I didn't respond to that. The idea that the brain is rewired, or that we have these exposures that then change the way we think. Young people are more vulnerable to that than older people. So you're right that parents are absorbed in the phone and all the rest. However, after about 25, 26 years of age, your brain, while not completely fixed, is pretty hardwired. And when you're 13 or 15, your brain is not hardwired. You're still pretty plastic. Around 9 or 10, it starts to firm up, but there's still enormous changes going on for the next 10, 15 years. So I think that alcohol, for example, alcohol for you might be more affected by a 6-pack of beer than a 15-year-old in a way, and that you might get more hungover and all the rest of it. However, your brain will not be damaged by that. But a 15-year-old's can be, because their brain is more plastic. And so regular use of alcohol or drugs is more damaging for a teen brain than for an adult brain, because your brain is hard, it's fixed. And so those kind of vulnerabilities are really different. So I just want to make sure that
I think it's very important message, actually. I'm happy that you took us in that direction. So let's go to the parents now. Just what are you seeing with parents? Like, do you feel like this discourse around mental health is also impacting parents in a negative way? Or do you feel like parents are more educated now? What's your sense of it?
Well, I think there's a trend, first of all, in parenting that has changed over the years, and every generation has its changes. I'm at the end of the boomer generation, and I'm the youngest of 5 kids. And I had a father who was very busy and a mother who was very busy. And I was a latchkey kid. I sort of came and went as I wished. And that led to a lot of my interest in risk, in fact, as you know from reading the book. But there's a positive to that, to not having your parent hover over you all the time. And yet I would have also benefited, as would have my siblings, from a little bit more management. And I think that the boomers grew up then saying, I'm going to manage my kids a little bit more, because they missed out on opportunities, and they were unsafe at times. And I want them to have a better structured environment. So the trend towards parenting has moved with the boomers towards a little bit more opportunity when we can afford to give it to our kids, a little more indulgence, and then a little bit more helicoptering as well at times. Now, that's not universal, but that's a general trend amongst probably middle class people in America, which is most people. So I think that there's a great strength to that. And there's so much we know to help parents to be more effective in their parenting and to help their kids stay away from bad things and move towards good things and all the rest of it. So I think that's a great outcome. But your question, how is it I can
Well,
Fine.
I'm just hearing, I hear from a lot of parents, like earlier on in their parenting, their parents, let's for example, are fighting amongst themselves about should we get our kid diagnosed with this or that, or should we have our kid checked out for this or that, or there's a lot of just general mental health discourse that has, I think, parents trying to diagnose other people's kids a lot. Like I just hear this kind of discourse a lot more than I used to hear it. And I think I'm just wondering if you hear that when you actually meet with parents. Do you feel like their ideas are coming off of what they read on WebMD or what they heard from their neighbor, or like how is
Sometimes.
all this
Yeah. I
influencing
think,
parents
I
is my
think we're,
question.
yeah, I think we're all influenced by what's around us, and there's so much more information around us, and that's good in a lot of ways, and some of it's misinformation. As we know, every day we see stuff that isn't actually right or correct. So I think it can be very confusing for parents, and it's good that we have people like you and me in our jobs and the parents in their jobs to set us all straight when there's confusion or difficulty. I have some parents coming in with a pre-assigned diagnosis, treat my kid for this or that, but that's not so common. I think mostly parents come in and say, I don't know what to do. I'm running up against some difficulties. And I think that's a universal experience that parents have always had, that their kids start smoking weed or something's going on and they're not sleeping well, they're not doing their schoolwork, friend groups have changed, they smell funny, something's different. I need help with that. And yeah, they're occasionally the same. The parents sometimes have the same problems or even worse than the kids have, and that can lead to conflict and difficulties. But that's not the case most of the time. Most of the time, the parents are there because they're really trying to figure out what's going on with their children. And as I said before, the good news is there's so much we can do to help those parents to help their kids. And that's not all therapy and medicine necessarily. Sometimes it's coaching and education. Sometimes it's trying new strategies. It's not all lying on the couch and talking about your mother for 30 years or popping a pill of Prozac. Sometimes that's all useful, but it's not one size fits all.
Right. And I really appreciate your holistic approach to thinking about this, because I do feel like we are all living in a world where, if you watch a televised sports game, you're going to have some information about some miracle drug, pitched to you,
Yeah.
every few minutes. Like, we live in a world where there are some advances, there are some very important advances in terms of pharmaceuticals, but also, the promise of a miracle drug is always there in our faces. And the reality of dealing with any type of mental health condition is that it's got to be all the things. It really has to be all the things. I'm interested in just your take on, I would say, like, the things that I've heard the most of research about. Like, I have heard that there has been an increase in depression among teenagers, and I've also heard that there may be some gender related, that more girls are susceptible to depression. I am interested to hear a little bit about the depression, what we've learned about depression, what if there are treatments for depression that you're seeing that are new, that are emerging, because I that does concern me, and I'd love to hear from somebody who works in the field about it.
So up until puberty, boys and girls have about the same rate of depression, and clinical depression. We're not talking about moodiness. I mean, real
Yes.
depression.
Yes.
And it's, depending on what you read, it's probably about 1% of children, before grade school, but a lot of those kids don't get identified. And then by the time you get to middle school, puberty happens. I'm sorry, in grade school, maybe 3 or 4% of kids get depressed. But by the time you hit middle school, those numbers grow and they start to separate between male and female. So that by the time you reach adulthood, females have about twice as much depression as males do. And that's a pretty consistent finding that we've had for a long time. And we don't know exactly where that comes from, whether that's societal in whole or part, or whether that's hormonal or otherwise in whole or part. We don't know, but we see that. Don't worry, boys win out in other psychiatric diagnoses. We have more ADHD amongst boys, more autism amongst boys, more Tourette's amongst boys. So it's, there are sex differences amongst all these things, but we do see that. Again, we have a lot of good preventative strategies, all that stuff I was talking about before. But when it comes to treatment, we have hundreds of evidence-based psychotherapies. but most of them for anxiety and depression rest upon cognitive behavioral principles that are very effective. And again, we can teach those as prevention, but when people are at a point where that's too much, or not enough, or they don't get those strategies, we can absolutely engage in cognitive behavioral and family sort of therapies that help a great deal with kids with depression. And that's for mild and moderate depression. It can help with severe depression too. But if someone topples over into sort of high, moderate, severe depression, then thankfully we have dozens of medications that can be helpful. And the medications can be life-saving, and they're valuable, and they can make an enormous difference. It may be the first strategy, depending on the severity of what's going on. It may be the second, third, fourth strategy, but medications can be very useful and are an important part of our toolkit. And are there new medicines? Yes, always. How helpful they're going to be, hard to know, because medications typically get studied in adults because adults have fewer side effects, adults are healthy. We usually use healthy college-age white men for a lot of our drug studies. And so
Right.
that's historically what has happened.
That'll tell you only about white men, right?
Yeah, so they'll tell you about that. So, but they don't tell you about every population. And we rarely have looked at kids when it comes to medications. Only about 10 or 20% of our whole pharmacopoeia has been studied in children, but we use all 100% of those medications available to us in children when we think it's necessary. So we are often using medications off-label for kids, which means we don't have a lot of data, but we have clinical experience. So, child psychiatrists will have, clinical experience, but they not with everything and only with their population of kids. And that's where, unfortunately, a lot of our stuff rests. We have some very good data on some of the medications, but we don't have data for a lot of them. Some of the newer medicines, some of the, for example, psychedelics that people are hearing about, we know that they can be helpful in some cases with adults with some disorders. We're learning. We're just getting back into that. That was an area of research in the 60s, wasn't well organized or well thought through. It was sort of put aside because of all the societal fears, and now we're uncovering that. We have things like transcranial magnetic stimulation, TMS, which there is a little bit of data on adolescents. We don't have much. So these are things that we're learning, but the treatments are good. The treatments we have are good. We need to use them. We need people who are trained to use them.
Yeah, I agreed. You raised the psychedelics question. I was actually gonna share something that really has been a source of hurt and pain for a very close friend of mine who had a teenager who was let's just say self-diagnosing and self-medicating, and found acid and was self-medicating with acid. And I don't think it went very well in terms of I think it probably worsened the situation. What are you seeing with teenagers and self-medicating, and how they're self-medicating today, and what concerns you, and what message do you want to have, put out there for parents about that trend?
Well, people self-medicate all the time, and we've been doing it forever. If we are sad and we can get drunk and it makes us feel better, maybe sometimes we do that. Or we're anxious at a party, we drink a beer, that's self-medicating too, because it lubricates the social environment. But when it comes to things like hallucinogens or strong, high THC percentage marijuana, for example, for years and years, we've known that people who are seriously mental ill sometimes turn to those things, maybe to relieve symptoms they perceive, which may at first relieve them, but often makes them worse in the long run, or sometimes even in the short run. We see that all the time. The thing that concerns me, I don't know that we're seeing more of that. We'll wait and see as legalization of marijuana in many states takes hold. We are seeing slight increases in the use of marijuana, but not like so far, not enormous increases. In children and adolescents, we are seeing pretty big increases amongst young adults who can access those things. So the 20-year-old population, because it's 21 and up typically for marijuana. So we are seeing higher uses there, but amongst teenagers and things, the trends aren't that much higher because they can't generally go into these stores and buy these things. They're still getting it on the street, and the availability is roughly, maybe it's more, but it's not so much more. But self-medication has always happened. And the problem that we're seeing is that there are very strong forms of marijuana now. So when I was a child, marijuana had 2, 3, 4% THC, which is the hallucinogenic or the active chemical that makes you high. And now the average is about 18 or 20% THC. And you can find oils and dabs and waxes with 60%, 70%. And that is, for some people, very, very dangerous, because we do know that people who are pre-psychotic or on the verge of having a psychotic illness, we don't know that we could ever prevent that or stop that from happening, but we know that exposing them to these high levels of psychosis producing treatments or drugs can make things worse, make things blossom in a much more intensive way, and probably worsen their disorder. So that's a big concern for us.
All right. This is amazing. I'm going to turn things back to Sylvie, and then we'll come back to you, Dr.
Sure.
Shatkin.
Sure.
So a lot to think about, a lot of things that we can, I would say, think about it as add to our list of concerns about teens. But I want to hear a little bit from a teen about what you've learned about mental health. And Sylvie, maybe if you could start with your own mental health journey and say a little bit about, like, Dr. Shatkin was talking about how do you become aware of your thoughts and the brain-body connection. And I mean, how did that work for you? I would love to hear a little bit about your journey and what you've learned along the way.
Yeah. So for me personally, I think I've always been very, very aware of my thoughts. Some of my family's on here, and I think they can definitely attest to that. Since I was just like a very little kid, I've always been a just extremely anxious person. And so in getting help to deal with those issues, it wasn't really my decision, and it wasn't really um up to me, and I honestly had no idea how to take care of my own issues because I was so young. And so the like decision to like get into therapy and actually seek out help for myself was very much um decided by my parents, and that's just because of how young I was. So I've always just been um I think, yeah, since a young age, I've been very, very aware of my thoughts and my anxieties. And I didn't necessarily know always how to label those and understand why that was happening to me, or even understand that what like those issues weren't something that everybody was dealing with. It wasn't necessarily like that. I never. It took me a little bit to realize that the way that I function isn't necessarily like a normal way to function, just like anxiety wise. But I've definitely always known that that's been like a struggle that I have, and something that I probably will always have. But yeah, so I think that it's just something I've always been fairly aware of. But I know that a lot of other people like start having issues like later on in their life or in their teens. But for me, it's something that I've always had.
So I know that you when we spoke, you said you've been very open with your friends about your own mental health journey. Um, how do you feel things are like? Do people openly share about their mental health journeys? Tell me a little bit about, like, what is it like in your peer group with your friends? Like, is this
Yeah.
something that people are okay talking about? What?
Yeah, I would definitely say it depends on the person, but based on the people that I surround myself with, and also just generally in the community at my school, it is pretty openly talked about. People are pretty tend to be pretty comfortable in talking about their own struggles, and of course it depends on the person. But yeah, I would say that for my the people that I'm around, it's definitely very normal to talk about your own struggles, and to even like help your friends and just be there to listen to them as they, go through whatever they're going through.
I know that you were listening when I was talking with Dr. Shatkin about just like teenagers and going on TikTok and like self-diagnosing, and like did you have a reaction to that, or do you have any thoughts about like what you see in terms of your peers self-diagnosing or diagnosing other people just based on one encounter or what have you? Like what are you sensing as is the um I would say the trend of in terms of mental health right now?
Yeah, I think that this has lessened. Probably, I mean, I'm sure it still happens and goes on, but I think especially as we're kind of more COVID restrictions have lessened, and we're kind of back to more normal life now, and just as the same as like also as I've grown up and gotten older, this has become less of an issue. But I think that when I was younger, and like during COVID, that was definitely a very big thing that happened with just especially because now in this day and age we're so much more open to talking about mental health than has ever been the case before. And with that, like I kind of said at the beginning, just so much new information has been shared, and as people have been talking about it, they're more comfortable sharing their own experiences, and with that becomes so many new terms and labels. And I think that another thing about my generation is that people are very inclined to put a label on everything for themselves, and that I think that definitely goes along with being a teenager because you're trying to figure out who you are and you want to label who you are and understand who you are, and so that you become really inclined to label that. And so I think with self-diagnosing like mental health issues, that's just another form of wanting to kind of label yourself. And I think that in some cases, it's not bad to wonder if you have an issue, if you're learning all this information and you see yourself reflected in it, and you're like, maybe I have this issue, maybe I should reach out to an adult or a friend about it because I think I might struggle with this and I want to seek help. I don't think that's necessarily a bad thing. I think that can be really good, especially if you're
Yeah.
seeking help. But I also think it can become dangerous when it's sort of this, because especially in COVID, it became this kind of almost like a contest. I felt I experienced this amongst friends, like a contest for who could kind of have who could be doing the worst almost, which was just
That's
very
terrible.
alarming. Yeah, it was very alarming. And for who could kind of have the most issues. And I think that that was definitely something that came out of COVID and social media, especially just with everyone talking about it. So I think that was definitely harmful. And and I think in some ways it was almost a trend to sort of have like a certain struggle and a label to put on that struggle. And I think that was harmful, and it was a harmful, especially just because then I think it caused some adults to look at the situation, like take the situation less seriously because they were like, oh, all the kids are doing this, like they're just self-diagnosing, it doesn't, like, we don't need to worry, where when while some kids truly were struggling, truly did need help. So I think that it could be okay when kids were, really just trying to figure out what was going on for them and figuring out how to like best achieve help. And then it was harmful um when it was just taken out of when it got out of hand and became sort of like it's something that stemmed out of social media.
No, I think that's it's a very clear articulation of like the challenge of it all. That there are people that really need help, and because like if they say it at a time when everybody's saying I need help, like they're not heard. And that's can be really, really detrimental. You shared with me that your parents were super supportive and have been very supportive, but I know that you must have friends who are um, facing mental illness or a mental health struggle, and their parents are not supportive, or their parents are dismissive, um, or worse. Can you like what would you say that parents need to hear, or what would you say that parents need to know about teens, and like what message would you want to give to them?
Yeah. I think that it's very important to understand that mental health struggle is a really very real struggle. And that because I do have friends whose parents kind of see it as not as valid of a struggle as, a physical illness. And sometimes it's not. Sometimes mental health isn't as big of a struggle as whatever physical illness, but it also can be. And I think that parents really need to take those issues seriously. And I've been lucky enough to have parents who do take those issues seriously. So when I have friends that have parents who don't, it's honestly kind of hard for me to wrap my head around, just because I've never had to deal with that, fortunately. So I think it's just really important that parents take it seriously and that parents listen to their kids and understand that um, it's important to be there as someone who isn't going to get really upset or frustrated if their kid expresses their own feelings or need for help.
Right. So, Sylvie, I want to shift the conversation a little bit, and here you're really the expert for us. Ever since the attacks of October 7th and the impact that those attacks have had on Jewish people globally, I've been concerned about just like the well-being of Jewish people and well-being of other people, but I have been concerned about the mental health of Jewish people and how all of this impacts us. I mean, I know that every day I spend way too much time reading the news. I spend way too much time catastrophizing and in a place of fear. And I I know that when you saw the impact this was having on your friends, or at least your friends from the Jewish community. I know you have a diverse set of friends, but when you saw the impact this was having on your Jewish friends, I know that it activated you and you felt like you wanted to understand a little bit more about what was happening. So could you share a little bit about what you were sensing and then what you did in response to the things that you were hearing?
Yeah. So I think at first, after it happened, definitely just general sadness and fear, just especially for people I knew that had family there in Israel and wanted to make sure their family was okay. So of course that was um part of it, was just the general like fear and anxiety and just like general sadness about what was going on, because it was of course terrible. And then a little bit after that, I definitely felt a general sense of like anger amongst Jewish teens, because for whatever different variety of reasons, like in my school, a lot of people were frustrated that our school didn't react soon enough or say something soon enough regarding what had happened. And a lot of people felt similarly, and a lot of people were upset by just different reactions to the situation that didn't align with their own, and they felt attacked or as if they weren't being heard or seen. And so I think that it just generally created a lot of just tension amongst teens, especially when a lot of Jewish teens have like a variety of opinions on the issue, and that caused some tension between like our own community. And of course for Kol Koleinu, which I was a part of through Moving Traditions for the past years, I did a project with my partner on we wrote an op-ed about the impact of anti-Semitism on Jewish teens' mental health. So we learned a lot through that, just because we did a survey and we found that a pretty like decent amount of teenagers felt like a big increase in just their or decrease in their moods, an increase of people found a decrease in their moods since October 7th, just due to like fear and anxiety and growing anti-Semitism. And even before October 7th, of course, I think anti-Semitism had a big impact on the mental health of teens, just because it put teenagers in a position where they like couldn't really be themselves. And especially, again, this ties in with social media. A lot of people will post their beliefs on social media, and sometimes those are anti-Semitic, and that, I think, on social media you get a very skewed perspective of the world. So when you see one post that's anti-Semitic and a bunch of people commenting in agreement, you feel like that's the whole world. And I think it's just very scary to feel that, and saddening to feel that like anyone could hate you or want to cause you any kind of harm just because of who you are, and or like your religion, your culture. So I think it's just definitely saddening in general, and lowers and can like certainly lower self-esteem and just cause fear and anger, especially after October 7th.
Mm. I mean, first of all, Sylvie, thank you for writing about this and thank you for asking your peers about this and like helping just surface. I actually think it's just healing that you took the step to like talk to other people about it and make people aware of it. So I really, really appreciate that. I'd like to just bring Dr. Shatkin back into this conversation. You know, it strikes me, I know personally, like if I see a friend of mine who is like um liking something that I find harmful to Jewish people, I know it's painful. I know it's painful, and I'd love to just hear I mean, it doesn't necessarily have to be about anti-Semitism specifically, but what is the impact of racism or homophobia or transphobia or anti-Semitism on a mental health perspective? Like, what is the impact of hate from a mental health perspective? Let's start with that, and then maybe and I'll let you just react to what everything you just heard Sylvie say.
It's a great question, and we actually have a lot of information about that. We don't have experiments where we take people who were exposed to anti-Semitism and compare them for 20 years to people who aren't, or racist ideas or anything else, but we certainly know, looking at neighborhoods, and we certainly know sociologically, that when people are exposed to discrimination, and as far as we know of any sort, but that makes them feel the other, that has a real effect on who they are. It causes an increase in cortisol levels, for example, which is a wonderful hormone that helps us to respond to all sorts of things, including align our circadian rhythm. But at high levels, it puts us in some sort of a fight or flight kind of a response. Epinephrine or norepinephrine, same sort of thing. And we know that amongst people who grow up in impoverished neighborhoods, people who are exposed to lots of racism or otherism, whatever the ism is, have higher levels of cortisol. Translates into better protection, right? A higher sense of, okay, I got to watch out for myself. But at high levels and over many years, translates into higher blood pressure, more weight gain, more body pain, more depression, higher rates of behaviors that are not health promoting, like cigarette use or drug use or alcohol use, less sleep, all of the worse food choices. And all of those things align with fewer opportunities to stay healthy in terms of what's available in your neighborhood. You know, most of what keeps us healthy is not a good doctor and a good hospital and even having health insurance. Most of what keeps us healthy is where we live, our zip code, and the environments in which we exist. And so poor neighborhoods, death rates are lower. You know, that is, people die earlier, and higher levels of toxic stress. So that's very clear. And we've understood that now for 50 or 60 years. And we only have more and more data on that. So whatever other you are, if you perceive that discrimination, it's not good for you.
And what are your thoughts just about the impact of just specifically, I'm thinking about lots of parents who are going to be either listening right now or going to be watching this later, are thinking about, like, anti-Semitism is a reality in the lives of teenagers now in a way that it hasn't been before. How should I react as a parent? Like, what are your do you have any words of wisdom for parents about, like, how they might respond to this?
Yeah. Well, I think it's all relative. I mean, I can't look, I'm in New York now, and I've lived in New York for a little more than 20 years, but I'm from a suburb of San Francisco, 10 miles north of a town called San Rafael. And I experienced anti-Semitism growing up all the time. It wasn't like it was brutal, and I had lots of friends, and those people who were saying anti-Semitic things were very commonly friendly to me or peers of mine, but they would use slurs a lot. And I was always acutely aware of being Jewish. Although raised a Reformed Jew, I always knew there was something different, but I took pride in that. I liked that. That felt really good to me. And that was, so the otherness wasn't so severe. I don't think it crippled me, but I definitely knew that I wasn't the same as everybody else in certain ways. And that was pointed out to me constantly. So I took that as a badge, as opposed to I have to pull away and be frightened. So to the degree that's possible, that's what I've encouraged my kids to do. To see this as a point of pride, a point of this great unique history you're a part of. Why it is that we're 15 million people in the world and everybody wants to do us harm, I still haven't figured that one out. But recognize that as a point of uniqueness and a point of strength if you can. I think that for kids, I think what makes it so much worse now is the anonymity of it, that people can post things and people can say things. And so you feel like you're getting it from all sides, and you're not necessarily just getting what you see on a daily basis walking down the street. You're imagining it's in places where it isn't. And because of our propensity, negative brain bias, to look for the things that are going to harm us, I think it does put us on a higher alert than we've been in the past. So my response is always education. Talk to your kids, see what they know, see what they need to know, ask them what they're learning, what they're experiencing, share with them ways and perspectives that they may not have at their age yet, and that you can fill them with those hopefully ideas and strengths that they can use, and perspective shifts, because so much of this is perspective shifting. And when we overly accommodate for our children, we do everything to protect them because, of course, we love them and would stand in front of a train for them. But when we accommodate too much, it's not good for them. They need to also develop a strong skin and a way to deal with the world. So I'm not saying ignore their anxiety, recognize their anxiety. And that doesn't give you a free pass for life because you have anxiety. That doesn't give you a free pass because you have depression or psychosis. You still have responsibilities. We just have to find the pathway for you and the right way and support you, and also still give you opportunities to strengthen yourself through practice.
Yeah, I've been thinking a lot about this anti-Semitism in particular, and I feel like, you have your external haters, and then you have the external people that love the Jewish people. They're not Jewish, but they love the Jewish people. And it's always helpful to like right size those things and not like not think the whole world is out to get us, and not think like, not
Yeah.
have realistic picture there. And then there's the internal piece, which is like you want your self-love to be a little bit more than your self-hate. It's like your self-hate is never going to go away, but you want your love to be a little bit stronger. And the way that you said it, Jess, like pride, your sense of like, I know who I am, and I value that, and I'm part of a long history of people who had to struggle and survive and find how to be resilient. And so that's a big part of it. So I noticed we're coming close to our time, but I noticed there was one question which was about teens and therapy specifically. And right now there's been a trend for a lot of therapy to go online. And I know that for teenagers, that may not be the best kind of therapy that they need. I'm just wondering what your thoughts on teens, and what are the best kinds of therapies for teens. And maybe Sylvie, you've had experience like with like good and bad therapists. I know that. Like what makes a good therapist for a teen, and what kind of experience is good for a teen in terms of having an older adult who they can talk to?
Well, if you're asking me, maybe I'll start. Sylvie, you can share
Yeah, go ahead.
But if you're asking me, it depends on the problem and depends on what you're dealing with, because we do have good data and good studies showing that online treatment can be really good for certain problems. Online treatment is as good as in-person treatment for certain types of cognitive behavioral therapies, certain types of medication support. That's all good. I like in-person more. I like to see people below the shoulders as well. And since I deal with some very sick people at times too, I want to smell them. I want to know if they're showering. I want to see what their clothing is like. I want to make sure that they're meeting a lot of their milestones and addressing the kind of concerns that demonstrate that they're functioning well in the world, because you can hide a lot behind a screen as well. And so obviously that concerns me. Smell was a metaphor, by the way. I'm not going around sniffing my patients, but it was like, I want to use my senses, not just my vision and my hearing. I want to get a sense of who this person is. And a lot of it is how they walk and how they move and all the rest of it. But we have good data that a lot of therapies that we do can be done online. So that's part of the answer to your question. And the other part is therapy itself depends upon what the problem is, because not everything, it's not a one size fits all. So you have some kids who need more family work or more parent work they need, or some kids who need more specific focus in certain types of therapies, and others that can be a little bit more generic. Generally, the same sorts of things that help in therapy across the board are things like the relationship with the therapist. So having a good relationship with the therapist is arguably more important than whatever techniques the therapist is using. If the kid believes that the therapist is in support of them, is advocating for them, cares about them, they tend to do better. And the therapist tends to have a greater investment in the young person as well. So age doesn't necessarily matter, although in many cases a younger person would like a younger person to deal with. But and we do age and we are different, and that's all true. Still, there's a certain amount of connection that matters more than any other perceptible thing.
Yeah, Sylvie, would you agree with that? It's about the connection,
Yes.
or
I definitely think it's about the connection. I think that's very important. However, I will say that I as I got older and I kind of switched around therapists a few times, like there were times where I can think of like one specifically that I had, and I haven't had many, but I did have one who like we connected very well. She was super nice and like I could totally talk to her, but she just wasn't really helping me at all. Like she didn't really provide me what I needed. Because I think I needed like really direct help, and she was kind of there almost just to like listen to me and kind of like hold my hand. And I think that while we did connect, they're also like I think it's still important to remember that like the type of therapy you're getting and the like strategies they're giving you is also can be important. But of course, just having someone to listen to is enough and what certain people do need. But in my situation, it wasn't. But I think, yeah.
Great. So thank you both for just such a fascinating like conversation. I'd love to get you're both experts. You're both experts. I'd love to get like different perspectives on the topic. What we're going to do now is we're going to offer an opportunity for folks who are parents to stay on and to meet and talk with other parents. And I'm going to stay on as well. And at this point, if you are not a parent and do not want to stay on and be part of this conversation, we have a evaluation of this. We'd love to get some feedback. But we're gonna right now just break up the folks that we have here. There are close to 50 people on right now, and we're gonna break off into a smaller groups. And in the smaller groups, we just ask that you listen respectfully to each other, allow folks to speak, try to be kind. If you want to keep politics out of it, that's generally a good thing. And to think critically, but also to not criticize others. So if you would like to stay on and meet some parents and talk to some parents, we invite you to do that. If you're going to take off, thank you so much for joining us. Please give us some feedback, and please stay tuned as we're going to be offering more Raising Up Teens some webinars in the future. But again, I want to thank both Jess and Sylvie for such a phenomenal conversation. And thank you for your honesty and your candor and your sharing of your wisdom with us tonight.
Pleasure to be with you. Thanks for inviting me.
Thank you so much.
Thank you.
Night.
All right.